Welcome, I'm Barb Stein, and I am the Trail Chair of Social and Educational Activities. So Trail members can come to 6 or 8 activities a month that usually are things like topics that all of us are interested in or activities. And Michelle and I often do things together because we know we share a population in terms of being elders. So we felt very lucky that on the Trail board, a member of our guest staff presented to the board and said, this is what the SOMI Institute can provide for the community. And this is in the College of Nursing. And they have all kinds of topics related to aging and all kinds of supports. So when I went looking for someone who might know about arthritis, I got this wonderful speaker. And if I were to tell you all of the things I learned about her and all of her degrees and awards, we would never hear anything about arthritis and chronic pain. But I want to tell you that she has worked for 37 years in the College of Nursing, and her research has involved things about caregiving, about arthritis, about pain, palliative care, end-of-life issues. So she has been immersed in issues that are very important to us. So I'm really looking forward to hearing this presentation. And please welcome Dr. Keela Herr, and she's going to fill us in. And welcome to Zoom people. And Michelle has decided that she will record this. So after her team gets finished editing it, it will be on the Senior Center website that you can see again if you missed something. Those of you who came in late, there are handouts on the table. And let's give her a warm welcome. Thank you. Thank you.
Thank you, Barb. Okay, if I click it there, is the audio okay? You hear good? Okay, great. Well, thank you. Thank you for the invitation, Barb, for the introduction, to have an opportunity to share some information with you and some resources that I hope will be valuable to you. A little bit about the SOME Center, which it doesn't look like, it looks like Kasome, but it's SOME. And the College of Nursing was gifted an endowment to create a center focused on gerontological excellence. And it is centered in the College of Nursing, but it's an interdisciplinary center. And so we have members on our leadership board from a variety of colleges in the college. We have a large advisory board that represents a lot of different organizations, but the focus of the SOME Center is to advance optimal aging through a variety of different ways, through supporting research, through education of providers and the public, and other kinds of outreach activities and initiatives. So it's a great center, and it would be really good for you to go to that website, browse it, and see what might be there that might be of interest to you. One of the things we're planning on setting up in the future, I think, is a consultation service, which might be helpful as people have issues or questions to be able to guide people in the right direction. But my talk today is about chronic arthritis pain, strategies and resources for management. And I'm going to talk about the problem a bit, talk about strategies for managing it, and then I want to share primarily resources with you that might be helpful to you as you deal with arthritis. So in case you don't know what arthritis is, it is an inflammation of the joints, the lining of the joints, but a lot of parts of that. So it's not just the joint, it's the cartilage, it's the bone, it's the ligaments, it's the tendons, the muscles surrounding the joint. Those all become inflamed with arthritis. We have multiple types of arthritis, and actually when I was trying to get a little more information about it, I had no idea there was 100 different types of arthritis. Many of them, there are not very many people have them. They're kind of rare, but a lot of different variations. But the most common are osteoarthritis, which is what I want to focus on today, which is the wear and tear arthritis that most people experience with aging, and then rheumatoid arthritis, which is a different type of arthritis in that it's an autoimmune disease. And so what happens is the body starts attacking itself in the joints, but also in organs, lung, heart, eyes. And it also has associated symptoms like fatigue and muscle aches, loss of appetite. So it's more of a system disorder, and it is symmetrical, whereas with osteoarthritis, you might have hip and A joint, but with rheumatoid arthritis, it affects both joints. So because of our time and focus, I'm just going to talk about osteoarthritis because it is the most common arthritis and probably the one that many of you in the room are experiencing or have experienced. Osteoarthritis is very common, and 1 to 7 Americans experience it, and that leads to, when you look at the population, about 32 million people experience osteoarthritis. Some younger, but you can imagine that the majority of those are older, given that it's a wear and tear disease. So usually it takes a while when we get old enough to experience the symptoms from that. I thought it might be interesting to share a recent study about pain in older adults that was looking at the prevalence of chronic pain. So not just osteoarthritis, but it is a big contributor to the chronic pain problem that most older people experience. And so this study was a big national survey of 3,500 people. And what they found was that 37.8% reported chronic pain. And they defined chronic pain as pain on most or every day for at least 3 months. There are other definitions, but that's a pretty good one. There is difference in that also based on race. So if you look only at white Americans, it's like 42%. If you look at Asians, I think the number was about 13%, much lower. And Blacks was around 28%. And we think that a lot of that has to do with culture and openness to share and report pain that would lead to, documentation of this. So osteoarthritis most commonly is located in the joints, so knee, hip, hand, back. Can be one joint, can be multiple joints. And there are risk factors for why do some people get arthritis and some don't. The age-related changes is just that the more it is related to age. So the older you get, the greater likelihood that you will experience osteoarthritis. There are genetic relationships to whether or not you get osteoarthritis. If you have a family history of it, you're more likely to get it. And gender, women are more likely than men to get osteoarthritis. Some of that relates to previous injuries and their impact, the kind of work people have done in their life and what kind of burden that puts on the joints that can contribute to the wear and tear. Lifestyle factors, and this is a big one that's going to impact what we're going to talk about as far as what do we do to treat and prevent osteoarthritis, and the factors that are known to be associated with getting osteoarthritis are a sedentary lifestyle, so not being physically active and getting exercise. Overweight creates a great burden on joints. And then repetitive stress activities that relate to our work or other things that you do in your life that might affect the joints. So I already talked about arthritis being a disease of the joints. And the symptoms are joint pain, swelling, and reduced range of motion of the joints. So back to the other slide, about 1 in 7 people have osteoarthritis. I just want to show of hands here. How many of you are experiencing or believe you're experiencing osteoarthritis? Okay, so pretty much all of us. We are a biased audience. So it's not really fair to say 1 out of 7 because the nature of this talk would bring people who are interested in it. The problem with arthritis and why we want to try to manage it is because it impacts our life in so many ways. Our ability to do daily activities, it can contribute to depression and anxiety if our life is impacted and we are not able to engage in social interactions, our physical activities, which leads to less interaction socially with other people. People can become isolated and withdrawn. and ability to engage in recreational activities can be impacted. And not being able to do recreational activities, especially if they're physical, can actually make the problem worse because we're going to talk about activity is actually the best thing that we can do. So the good news is that you can live well with osteoarthritis, and I'm hoping you all will share when we have time to talk towards the end about how you've been able to manage your osteoarthritis. There are treatment options, and there's a lot of different treatment options, but not everybody responds to the treatments the same way. So you have to find those that work well for you and help you in managing your discomfort. So in moving forward, to be able to have a positive experience and be able to cope with arthritis in a way that lets you do the things that are important to you, I think it's important. There's a number of things. You need to understand your pain, and then you need to share it to get the resources and supports that you need. And so the first thing is to evaluate and document your pain. And I'm going to talk a little bit more about that later, but understanding, you know, where it's located, how severe is it, when does it happen, what makes it better, what makes it worse, all of the experience of pain and living with it, and how it affects your life. You know, what is it doing that is limiting you having a fulfilled life and doing the things that are important to you. So setting goals of what do you want to be doing that you're not able to do because of your arthritis pain can help in developing a treatment plan and trying to set, you know, maybe one of your goals is that you want to be able to spend a half an hour visiting with your grandchild or playing with them, and you haven't been able to do that. So that would be a goal that then you can target to see if you're able to achieve that with the treatment plan that you come up with. So developing a plan to manage arthritis, evaluating what the plan is, and if it's working, are you able to do the things that you've set as your goal? And short-term, long-term goals are good to have. And then you may have to revise it. So if some approach that we're going to talk about isn't effective, then you move on and try something else. But you don't just keep doing the same thing that's not working. So in understanding your pain, one of the first things if you go to a healthcare setting is they want to know how bad is your pain. Okay. And so this is a tool that we developed to try to help people that have issues with abstract thinking or understanding how to communicate pain, all kind of in one thing. So the thermometer helps understand pain, that is temperature rises, pain increases. And so some people that might have trouble understanding that's just a graphic to help with it. You're probably usually asked about putting your pain on a 0 to 10 pain scale. Most older people prefer, actually, a lot of my work has been in the area of pain assessment. What's the best way with older people to evaluate pain intensity, and what tools can we use so that they can understand and reliably report their pain over time. And so most older people prefer to use words just to describe whether they're not having pain or if it's mild, moderate, or severe. And so this tool just kind of puts them all together. So just choosing a tool so that you're able to rate your pain, to communicate it, is one part of the understanding your pain and being able to share it with your provider. But we've really come to understand it's really not how severe pain is that's what's important. It's how pain impacts your life. So thinking about how severe the pain is, are you able to enjoy life? Are you able to engage in general activities? This is a short tool that was part of a 10-item tool that looked at pain interference, and it was narrowed down to be brief, to be able to just report on some basic elements of impact of pain that you can use over time to see how is it changing. So, you know, if you did this at baseline, like tomorrow, if you went home and you started keeping track of pain and its impact, wherever you're rating it, and maybe you look at it a week later as you're trying different interventions to see, is that getting better? Is the interference of pain in my life becoming less? And that is really good information for you and then for your provider as well. This is one other tool that I thought was kind of fun. The Pain Disability Index has been around for a long time, but they've developed an app. And if you go to this link, And it'll be in the materials if you want, because you're not going to remember it up there, or just Google Pain Disability Index. It's an app that you can go in and you click on the different 7 items and it moves across it. I just thought it was pretty because it's colorful way to capture. Unfortunately, they don't have a way to monitor and see those changes over time. So it's kind of like a shot when you do it. You can see what it is and maybe you can write down the numbers. But for those of you that like to be on the computer, it's a different way to do it. And then I mentioned you need to share what you're experiencing. And we recommend the use of a pain diary. So a way that you can document the important parts of your pain experience to be able to share them with your provider or even yourself, just to be able to keep track of, how's your pain? How bad is it? Is there anything that triggered it? What intervention are you trying? And then after you've tried that, rate your pain again to see if it's improved, so it helps you and your provider to understand if that intervention is effective or not. So that's just a little bit about the importance of capturing information about your pain so that you can share it. And I want to talk now about treatment options. And as with any pain problem, we're talking about arthritis, but any chronic pain problem that you might have, choosing the treatment option is really, it's an evaluation and weighing the benefits and risks of the different treatments. And we know that pain medications can be an effective treatment, but most of them come with some risk. And so you need to look at what are the risks. How does this relate to what pain and its impact is having in my life? And to try to have a conversation about what do we need to do next. The other thing that's really important is preferences and values, and that's your preferences and values. When you're putting together a treatment plan, whether you're doing it yourself or if you are working with your healthcare provider, which we strongly encourage that you do that, they need to understand what's important to you and what are you willing to try as far as treatment options, because many people have preferences. For example, one might feel, I don't care how bad my pain gets, I'm not going to use opioids. Okay, that's a preference and that's important to share. Another preference or, a value that some people hold is that it's important to not complain about pain, just live with it because that's just part of growing up. Sorry. And that's something that you want to have a conversation about because it's not necessarily true, but it is a barrier that interferes with treatment and with providers being able to help come up with a good plan for you if you're not open to seeking treatment and being willing to try different intervention approaches. I also think it's really important that when you approach chronic pain management in general, it can involve medications, non-drug treatments, impact on activities of daily living and other things. And should be the center of a team. And there should be other providers and people that you work with to come up with the best plan for you. It might be a nurse or a nurse practitioner. Occupational therapy, physical therapy are very important with arthritis in particular. Pharmacists for medication management and looking at where there are drug issues that we need to be thinking about. And PCP stands for primary care provider. That may be a physician, a nurse practitioner, physician's assistant. But this is a team of people. And depending on other problems that you might have, there are other disciplines and providers that bring important information to the table and looking at a treatment plan. But I think the main point that I'd like to make here is that you are the center of the team and you need to be open and in communicating what your preferences and values are in working with this team and advocating for yourself as well. So one big thing about arthritis and chronic pain management is a lot of it is on you and self-management plays a huge role. And in doing that, I think it's important that you get knowledge about pain and what you can do about it, develop skills and confidence, not only to prevent pain and to cope with it, but to reduce it. A lot of the interventions that are recommended for arthritis pain are things that you can do and manage yourself. There are a broad range of complementary and alternative approaches, as I said, that are really things that you can seek out, learn, and implement yourself, or have a partner or a caregiver or someone that is able to help you do that. And that you need to take the lead in carrying out the intervention with or without someone else's support. That's kind of the definition, some of the key elements of self-management. And there are a lot of complementary and integrative medicine approaches. This just kind of is a graphic, has a fun way to look at the many, many things that are out there that are for chronic pain management. And these are a list that I put together of things categorized to help you to understand how they might help with pain management. On the left are physical interventions, and these are things that you can do that impact your body in response to pain that are physical. Exercise being top of this list because it's a critical and important intervention for chronic pain in general. And not only from the perspective of, we know exercise is good for us, but exercise actually causes changes in the brain that have a reduction effect on the perception of pain and the experience of pain. So studies have shown not only that it's helpful just from the physical standpoint, but that it actually can impact the experience of pain as well. And there's a whole variety of different types of exercise. Physical therapy can be part of that. There are yoga, tai chi, lots of strength training, flexibility training, balance training are very helpful, but even just walking, and it doesn't have to be intense and it doesn't have to be for long periods of time, but regular exercise is an important aspect of chronic pain management and also for arthritis pain management, which we're going to talk a little bit more about. Thermal treatments like heat and cold, use of assistive devices, splinting, orthotics, positioning, use of a cane, TENS, acupuncture. These are for chronic pain. TENS, just looking at a report recently, said that there's not strong evidence for TENS for arthritic pain, at least in the hands and hips and knees. Massage therapy can help with relaxation, which can reduce your response to pain. And then there are other alternative therapies like aromatherapy, energy field, Reiki. So these are physical things that you can do. Cognitive behavioral are things that we do with our mind that impacts the way that we perceive pain and help us to cope with pain and alter the pain experience. So you may have heard about biofeedback which is a technique where you actually learn to control your body's response to sensations such as pain. Mindfulness meditation is a calming, relaxing technique that you use your brain to help to feel sensations and then reduce them and manage them through relaxation techniques. There are self-management programs that are just focused on helping understand your pain and how to manage it. Acceptance and commitment therapy is an intervention that helps with coping with chronic pain. And I'm going to share some specific programs that you might find useful. And distraction, you probably also just know that you can distract yourself from the pain at times. You know, music or humor or reading or something that gets your focus off of it so that it's not quite as severe. So there are medical and non-medical and lifestyle approaches to managing arthritis pain. And I wanted to start with these two because these are the two major ways to prevent arthritis and to manage it. Physical activity and exercise, as I said, these are lifestyle approaches to the way we live that can help with arthritis pain. And maintaining a healthy weight. We know studies have shown that overweight puts extra burden on the joints and that causes more pain. Interestingly, and I don't know how they evaluated this, but for every pound of weight loss, it has a 4-pound reduction on the pressure and the discomfort on the joints. So if you kind of think about that, it kind of magnifies the role that weight plays. And so both of these, finding programs and supports to help increase exercise or even just general activity and trying to maintain a healthy weight are important key strategies. Then there are also medical treatments, and I will talk a little bit about some recommendations related to medications, but over-the-counter medications. And, I'm sure that you all have tried those that are recommended, and that's, Tylenol or acetaminophen. NSAIDs, we're going to talk about those, the nonsteroidal anti-inflammatory drugs, which come in, and there are topical creams and gels, some that are nonsteroidal, some that are lidocaine, and then also some that cause some changes in the body so that you don't feel the pain as much. You can also get prescription medications from your primary care provider. And then ultimately there are injections and other therapies, injection of steroids into the joint or hyaluronic acid, which helps to improve the lining and the fluid within the joint. And then I don't have up here, but probably the last resort is surgery, but for some people that is a treatment option. And actually I was reading about knee joint replacement, and this paper was suggesting that about 50% of people ultimately do joint replacements for knee arthritis that gets severe. And then I also have alternative therapies here because these are things that people have heard about. You probably read about them on the internet and you may want to try some of them. And they're often considered alternative because they are not mainstream medicine, and the research evidence is usually limited on some of these, but that doesn't mean that they might not work, but just there's not a lot of evidence to show that they do in a controlled trial. But glucosamine, turmeric, different types of vitamins, CBD, we're hearing a lot more about people using cannabinoids to help manage pain, and fish oil are some that you commonly see that are related to arthritis pain management. So I just wanted to share a resource that this is the kind of resource that your primary care provider would be looking at. So we strongly advocate for evidence-based practice and using recommendations from guidelines that have looked at the evidence to determine what to recommend for treatment of different pain conditions. And so the American College of Rheumatology and the Arthritis Foundation went together to develop a guideline for the management of OA in the hand, hip, and knee. And this paper was last updated in 2019. They're probably in the process of updating it again because they go and look at what's new research and have we learned anything that would change the recommendations that are being used. And so they make strong recommendations for, and when you see strong recommendation in a guideline, it means that there's strong research and controlled trials to support this as an effective intervention. Exercise, weight loss, Tai Chi, self-efficacy and self-management programs, cane use, and then the rest of these depends on the joint. So, because you'll see hand arthroses up here, then other arthroses down here. Those are like splints, braces. Bracing is a strong recommendation up here for one joint, but not down here for the other. So topical and oral NSAIDs, and then intra-articular joint injection. So there's good evidence that these interventions are effective. Conditional recommendations mean that there is evidence, it's not as strong, which means they're probably, when they're looking at the studies, some are positive, some are negative, and it may depend on the different joints that the study was looking at or the population. And so that they say more research is needed, but you can still try these because there is some evidence. And so balance, yoga, cognitive behavioral therapy, taping, splints, bracing, acupuncture, hot, cold, topical NSAIDs, injections, and then the things that they list, well, chondroitin. Topical capsaicin is an ointment cream that you can put on the joint, Tylenol, duloxetine antidepressant, and then tramadol, which is a type of a opioid product. So we often look to these kinds of guidelines for information and support. I also wanted to share this guideline that's focused, and the last one wasn't focused just on older adults. And so it's broader, although most everything applies to older adults. This is a guideline that was prepared for older adults and looking specifically at pain management in older people. And it was actually done in the UK by the British Pain Society and the British Geriatric Society. And this was an update from an earlier guideline. And basically, there's been more of a shift in the last 10 years to more emphasis on non-pharm, non-drug interventions and trying those first, trying to really maximize the use of those because of the low risk. You know, once we start talking about medications, every medication that you might take is going to have some risk. And so the guideline it talks about some of the medications and some of the things to be thinking about and really encourages, you know, using and trying non-drug interventions. So I said I would give you a few caveats about topical treatments. So I don't know if you've heard about NSAIDs and that there are concerns with NSAIDs, mostly because of bleeding and development of ulcers, but also they can impact the liver and the kidney. And so their use long-term is not recommended. And even short-term use you can have problems. So we always have to be using them and being aware of some of the problems that can develop if we use NSAIDs. The American Geriatric Society, yep. Yes. Yep. Sorry. No. So NSAIDs are medications that have an anti-inflammatory property, which is what you need with arthritis because it's an inflammatory condition. And there's a lot of them, a huge list of NSAIDs, but the ones that you would be more familiar with are ibuprofen, Advil, Aleve, anything that, and actually you can get lists of them so that you know what they are. And they've been, pardon? No. So acetaminophen actually does not have, which is Tylenol, it does not have anti-inflammatory properties. So it helps with pain, but it doesn't help with the inflammation, okay? So it is challenging. And this is an area when you're looking at medication management that's very frustrating because the drugs, like the anti-inflammatory drugs that can help with the inflammation, have risks. And so again, you need to talk, you know, with your provider about that and whether to use them and how long you can use them and what are the things to be watching for if you're going to be using them. So I'm going to talk about that a little bit more when we get down here. So another type of topical that you may have heard of is lidocaine. There's a lidocaine cream that you can rub on the skin, and so it just numbs it, so it reduces the pain from that perspective. Anything 4% and higher, you need a prescription for, but there are a lot of products that you can get over the counter. Creams and ointments for pain shouldn't be applied over open wounds. You shouldn't use a heating pad directly on the area where you're applying it. Not only because of increased risk of burns, but also it can increase the absorption more than what is desired. So the guidelines really have shifted to recommendations for topical NSAIDs. So like Voltaren gel, you may have heard of that, which is an anti-inflammatory gel that you can rub on the joint. And the reason that those are recommended over taking like oral ibuprofen instead is that there's less systemic absorption. So it focuses more on the area that you've applied it. So the risk is less, but not completely gone because some of it is absorbed. So the risk for bleeding, ulcers, and affecting the kidney, it still exists, but it's much less. If you're allergic to aspirin or take blood thinners, you have to be very careful with products such as Aspercreme and Bengay because they contain an aspirin-like product. So that can be an issue. And timing for creams is you should put them on before you exercise. With any treatment that you are wanting to, like say you're wanting to increase your exercise or stretching, you're more likely to be able to do that better if you try a treatment before you do the activity. And then the other time that's a good time is after you get out of the shower and your skin's clean and you can put it on then. Do you have other questions about topicals? Yeah.
Time you take the medicine before you exercise.
Yeah, at least 30 minutes before. Most medications take between 30 minutes and an hour before you start having the effect of it. So if you're going to use it to help you be able to exercise more or walk longer or do whatever, taking it an hour ahead would be good. Okay. So this is a little bit more about the oral medications. So we do have limitations on acetaminophen. It's recommended for older adults to try to not go over the 3,000 milligrams in 24 hours. And there's a lot of caution related to acetaminophen because it's in so many different products that you have to really pay attention to what you're taking and what has acetaminophen in it or Tylenol, and keep a total of those because it's easy to take not an overdose, but you are going over the dose limit that then can affect your liver. That's the major concern with acetaminophen. And then the NSAIDs, as we've talked about, these are the dosing recommendations for the two most common. Ibuprofen and naproxen are ones that are commonly used and recommended, and these are the dose caps: 1,200 for ibuprofen, 600 for naproxen. You can do an NSAID and acetaminophen, and we often recommend, so if you're taking an NSAID every 6 hours, Tylenol every 4, to kind of time them so you're alternating them, so then you're actually taking something every few hours. But if you are going to take an NSAID, it's strongly recommended now that you use a gastroprotective agent. So that's something that protects the stomach and its lining when you're taking the medication. You may hear the words PPI, proton pump inhibitors, an example of that. So Prilosec, Prevacid, Nexium, those are things that protect your stomach. And so it's recommended to take those with the NSAID as a way of protecting the stomach. Okay, so wanted to talk about places to go and resources that I think are very helpful and are provide evidence-based resources that you can trust. You know, if you get on the internet and you just start looking for stuff, you can get taken down many rabbit holes and find all kinds of recommendations for things to do and try related to pain management. And it's really important to be sure that those things are sound and that there's some evidence to support their effectiveness and that they're not harmful is probably the biggest thing. But AARP has some really great resources. And if you, I don't know if you can share. Oh, it's not going up there, darn it. These are live links. So if you're willing to share the presentation, I'm also fine with that if people want to. But you can just Google AARP and pain management, and they've invested a lot in looking at ways to help older people manage pain And then also to support caregivers in helping manage pain of a loved one. I recently, within the last 2 years, worked with them on developing a video series about pain management and supporting the caregiver. And there's a couple I'll show you in the end that I think you might really appreciate accessing. So that's a great resource. The Arthritis Foundation has a lot of tools and resources and articles about pain management, and specifically arthritis pain, how to live well with arthritis. There's videos, there's things on, pain medications, alternative strategies, support groups, different types of group activities and locations where you can access them. So that's a very good resource. The National Council on Aging also has a whole set of information and articles about arthritis pain. One of the handouts that I gave you here is from the National Council on Aging Collaborative that came up with the Osteoarthritis Action Alliance, but it came from their site. But a handout with, these are all live links. Again, you can just Google this handout, just go to the Osteoarthritis Action Alliance, looking for joint pain, and you'll find this flyer, and all under each of these categories of things to do, which talks about physical activity, weight loss, pain management, self-care, social support, and healthcare. They've also compiled some really excellent links of resources and information that I liked this, thought that it would be a useful guide for you. And then I mentioned the Somé Center for Gerontological Excellence, where we have geriatricpain.org, which is a website of tools and resources that we've collected. And I'm going to show you what some of those are, and hope that it will interest you to go look at the site. This is a free website that we developed over the span of probably over 10 years, but we just recently updated it. And I'll tell you a little bit more about it here. So this is that handout that you have in your hands from the Osteoarthritis Action Alliance. Those websites will also help you to identify types of exercise programs, and connect you within, the local community with programs that you can attend. So senior centers, and I'm sure this senior center has opportunities of different programming, but a good one related to exercise is Silver Sneakers. And they have a variety of different programs. I don't know if you do. Okay. Arthritis self-management programs, and these are kind of structured programs that you can participate in with groups to learn about managing arthritis. There is a chronic disease self-management program, again, that was developed by researchers and now disseminated for use in communities. And sometimes hospitals have health and wellness programs. I don't know that I've seen that much from the university for older people related to that. What are some of the exercise programs that you offer here, Michelle?
They can find that in our program guide. We have
More than you can tell.
we have a lot of programs.
Yeah.
Rooms that people can use independently
Yeah.
outside of the structured classes.
Yeah, and that's excellent. So this particular senior center has a lot of space for doing exercise activities, programs and activities that you can join and do with groups, as well as just on your own as well. Yeah.
Walking in the pool, walking without that support.
My understanding that pool walking is as effective as other types of like walking outside as well. And actually, because you can do more to build strength because you're not having the pressure on the joints that causes pain. So I think it's a very highly recommended approach to doing exercise. So if you go to geriatricpain.org, this is kind of the homepage that you'll see. And at the top, you'll see we have 3 sections. We have one for clinicians, and there's a lot of tools for primary care providers about pain management. And then we have a section for older adults and a section for family caregivers. And each of those has tools and resources that are targeted to the audience. So if you go to for older adults, we have a section on communicating with your healthcare provider, on pain assessment, on pain management, and then links to pain resources outside of the web that we feel are useful and valuable. So the pain thermometer that I showed you, so almost everything on the site is in a PDF format that you can look at, but then you can download it and print it and have copies yourself, put it on your own computer if you have one. But you can print copies of this and have access to that, and it tells you how to use it. I already showed you the pain diary, but it is actually there so that you can download it and have a copy of that. We have a medication list, which is an important part of a treatment plan, is making sure that you captured all the things that you're taking, whether they're prescription or over the counter, when you're talking with your primary care provider, so that he can look at things that might interact in thinking about what's going to be best as far as the pharmacological management. We developed a tool for preparing for a visit with your healthcare provider. Has a way of capturing the information that you need to share at your next appointment, documenting what are the questions that I need asked. Because I don't know if you're like me, but when I have all these things I want to know, but then when I'm in the appointment, I forget stuff and I'm home before I realize, oh, that was the main thing I wanted to get, and then I didn't do it. So planning for that, right, capturing your pain information, thinking of the questions and concerns that you have can be really, really helpful as far as engaging them. I just wanted to show you what some of the tools looked like. So we have what's called fast facts, and we have them on a lot of different pain conditions. And they give you background on the problems, causes. This one shows a little bit more. So this is one on joint pain, talks about the different kinds of joint pain, and then possible interventions, and then what you can do as far as your next steps in seeking treatment. And then we have a lot of tools that talk about individual non-drug treatments and some also on drugs. But so if you went and you wanted to know about cold therapy, this is a 1-page tool that tells this is what it is, this is what you need to know about using cold, equipment you need, what you need to do in sharing information about it. Tai Chi is another example. Biofeedback.
Tai Chi is offered by the university in a very
Great.
fine class. It's very
Excellent.
long, but it's very fine. It's also offered by Zoom.
Great. So Barb,
Yeah.
okay. So Tai Chi, and Tai Chi, there's a lot of research on its effectiveness in chronic pain management because it's a very, slow guided movement, but it really builds strength and flexibility, which is really great. So this is, if you went into the site, we have some new videos that have been developed with AARP that are great. But there are a couple of tools that I think you might be interested in. One describes a lot of the different lower risk treatments for managing pain. So a lot of things that are non-drug related, but it talks about what they are, the risk benefit and considerations if you're using them. And then we also have a tool that captures the high risk treatments. And so these are mostly medications. And then some of the interventional techniques are considered high risk because there are issues and concerns you have to be aware of anytime you're entering the body. So my goal for all of us, me too, is in managing our arthritis, the goal is to have the best life that we can and have the best quality of life and be able to do the things that are important to us. And hopefully you'll be able to do that and put together your life to be able to do these things, visit with your grandchildren, engage in socialization with your friends, engage in physical activities, whether it's an exercise program or playing tennis or swimming. This is my baby who's now 29. He's the one that has given us our first grandchild, so. But anyway, this is our goal. You know, we want to stay active as long as we can, and so attending to our arthritis and pain problems is important. So, yep, let's talk.
I just want to say the Silver Sneakers program is available in this area. And a bunch of the for-profit gyms do it, and
Okay.
in North Liberty Rec Center,
Oh, great.
it gives you free access to the gym. You do have to pay
Mhm.
for classes, but you
Yeah.
can use the whole exercise machines and
Yeah.
all that.
Great.
And so if people go online, they can look this out where the gyms are that will do this.
Thank you. So someone mentioned that there are multiple silver sneaker programs in the area, a lot of time through gyms and places like that. I just was seeing that some of the Medicare supplement programs actually have,
They all, yeah.
Pay
that's
for
how
it.
I have it.
okay, great. Yeah. My understanding is it's just a structured exercise program with a variety of different approaches, but it's physical activity and exercise to keep seniors
Yeah, it's both
active.
in gyms, or you can do it online. They have-
I mean, it could be a yoga class.
Mhm.
I'm not sure where all it is, because I just found, I live in North Liberty, and so I just
Yeah, you
tagged
have
on to that.
Yeah.
But there, I now saw that there were many gyms.
I saw some of them, but I noticed it wasn't much
Mhm.
on the east side.
Yeah, that could be. And there's some program where they actually do a class out on sort of the west side of Iowa City, a couple of days a week.
Yeah, down by the golf course somewhere.
You might be able to Google silver sneakers near me and probably find some
Yeah,
places.
just to clarify, it is based on your insurance. You have to have a specific
Yeah.
health insurance to cover
Oh.
those classes. So they're just like the exercise classes that we offer here at the senior center. But they have gone through the process of being vetted by the
Okay.
insurance company. So for us here at the senior center, we have Renew Active, which is through United Healthcare. We've looked at becoming a Silver Sneakers site here, and it's paperwork heavy. And with Renew Active, you can come and do anything here and it pays for your membership. Silver Sneakers, we'd have to track exactly what classes you would go to, and it has to be a specific instructor. So it was just a little more complicated. We're still looking at trying to go through the weeds and have that be less complicated, but
Yeah.
it's not a program per
Sure.
se. It's that they kind of put their stamp of approval on a program and they call it Silver Sneakers. So.
So much-
Plus that they pay for using the gym.
Yep.
It saves
they
me
do that.
over $300 a year
Yeah,
to
Mhm.
just to go
Right.
say about this.
So there's clarification, I'm just saying it for the Zoom. There's clarification that the Silver Sneakers program is one that is supported by third-party payers. So it's been approved and vetted through that, but that's the main way that you're gonna get support for that. But senior centers and other locations also have exercise programs that you can engage in, and Renew Active?
Mhm.
Renew Active is the overarching program that this senior center uses. The main thing is just to get active and find something that you enjoy doing, that you can do. Sometimes it's important to get a social support, a buddy, to do it with you, to be motivated, to be a regular exerciser. But the research has been, it used to be, we were hearing, you need to have, an hour a day for 5 days a week. It is much, much less than that. It's really just even 10 or 15 minutes a day walking has beneficial effects for chronic pain management besides just your overall health.
We do offer the Walk with Ease program, which is an arthritis foundation, evidence-based program, 6 weeks, 3 times a week walking program. And the next session will be in North Liberty at the rec center because they have an indoor gym or indoor track. And that would be free. So we try to do it
Okay.
outside in the summer. What's it called?
Walk with
Walk with-
Ease, it's another exercise program.
That'll be in January.
Is that 2 miles?
No, it's a timed thing, so they start depending on your ability, you know, maybe you start walking for 5 minutes. And then you add on over the course of the 6 weeks, the goal is to get you walking for 30 minutes. So the distance doesn't matter as much as the time spent.
How about
I've
you
done it
first?
virtually, I don't have a car,
Okay.
so
Yeah.
trying to coordinate a bus to say Terry through Leonard.
Mhm.
Liberty would be impossible.
Yeah. right.
So, through, Iowa State, I got signed on to the Walk with Ease program
Oh,
virtually. So
good.
you do the walking, you chart it, you
Mhm.
record it. Plus they use the Walk with Ease book, which I already have.
Yeah.
a copy of.
Yeah.
Yeah,
Okay, so somebody mentioned that Walk with Ease can be an on-site program or an online program. And you can get the book and then run through the program. And actually, that's another good point to bring up is if you're looking for different kinds of physical activity that you can engage in, there's a lot online that you can sign up to participate in and just do them at home on your screen. But safety is another thing, you know, if you're doing activities, you make sure that you are safe, you're not a fall risk and that would be good, a walking buddy. Did you have something else that you wanted to say? I don't know.
Arthritis Foundation,
Okay, Arthritis Foundation?
online.
Yeah.
Get you a copy of
Okay.
the class.
Oh, there you go. Excellent. Yes. This one. Okay, you first.
I have two things. One is that for several years, I've been getting an injection
Mhm,
every 6 months. I forget the name of it, starts with the,
mhm.
but it's not for pain. It's, I don't quite understand. It's somehow to keep the calcium or whatever in the bones from.
Mhm.
Is it a plasma injection?
Not
Not
plasma.
plasma.
Hmm.
No.
Yeah.
The other thing is, people need to take seriously some things that happened this summer. My hand, I have arthritis everywhere, but my hand swelled up. The doctor said he'd never seen a hand swell up that much. And, they put me on a brace.
Yeah.
For when it's hurting and put me on prednisone for a week.
Mhm.
And, so pay attention,
Yeah,
you know.
yeah, not
Some people
overdue.
Need to really pay attention.
Yes, thank you.
I have a question.
Mhm.
I know they've x-rayed my neck and said I've got arthritis in my neck.
Mhm.
But in addition to that, I had problems with my knee. So I went to a place and they did 2 places, x-rayed my knee. And my doctor says I have arthritis in my knee. But when they took the x-rays,
Mhm.
he said the knee is fine.
Mhm.
But then he said, would you like the injection? And I'm thinking, if I have a knee that's fine, why would I need the injection?
Mhm.
And then he never asked anything about the muscular structure around the
Mhm.
knee. Is it possible that you can have severe pain where you can't put any weight on
Mhm.
it because of a muscular strain?
Oh, sure. Yeah, there's lots of reasons why we can have joint pain. Well, I can't tell you why he didn't, but you raised a really important point that I wanted to talk about x-rays. If we all had our joints x-rayed, probably all of us would show evidence of arthritis. And those who are not here that are not having pain would also show evidence of arthritis. So just having a positive x-ray for osteoarthritis does not mean that you're going to have pain. People experience it differently. And so it can support the diagnosis, but yet it isn't going to dictate whether or not this is going to be a problem for an individual to manage it. Yeah, there you go. Yeah.
I stopped using fish oil about the same time as this pain. You suppose there's a connection?
Well, you can't say because we don't know cause and effect. What you're talking about is an association. So if it were me, I'd go back on fish oil and see if it got better.
See if that does.
Yeah. Okay, one more question, then I think we're out of time. Right. Sorry you came in late. We talked about that in the very beginning, but the main difference is that osteoarthritis is going to be related to a single joint or multiple joints, but not bilateral. And you're not going to have other symptoms. With rheumatoid arthritis, you're going to experience fatigue, you may have poor appetite, you may have generalized aching. And you typically see it impacting other organs in the body as well, besides just the joints. So that takes a specialist, to evaluate and to differentiate that. And the treatment plan is also really different. Okay, one more thing.
Shoes.
Yes,
How can they affect?
absolutely. Anything that puts your body out of normal alignment is going to be a problem because it's going to worsen the weight and pressure on the joints. So absolutely, good shoes with good arch support that help to balance and align you is really important.
I have one comment.
Okay, okay.
This is from the Zoom.
Mhm.
Someone on Zoom says that they took the Tai Chi class offered by the university, hoping it would help with their arthritis, but it actually made their knees worse
Oh,
because they're in the bone on bone stage.
oh dear.
So, she
Yeah,
just wanted to
that's
make
something.
people aware that depending on what stage you're in, you're gonna have experience issues.
Different outcomes. And so I think the point that she's raising, which is really important, and I want to make sure that I emphasize it, is that you should have an evaluation by your physician or other provider to understand what's going on with you, because it really will dictate what is going to be appropriate for you as far as the treatment plan. So that's really important. Okay,
One
Barb.
quick thing, Mercer Park has an arthritis swimming class that Becky Harkamet teaches, and she is exceptional in her understanding of the body and what we do. Mercer Park swimming pool.
Yeah, I used to go there.
Yeah, Becky Harkamet teaches an arthritis class there.
Becky, who?
Harkamet,
What time is it?
I have no idea. I go to her online chair class.
If you go to the city, Iowa City, the recreation pools, there's several steps. You get to the schedule for the Mercer pool.
I think it must be afternoons because some of the people in my chair class go to swimming too.
Well,
So,
it used to be in the mornings, but it's been a while. since
yeah,
I've done
I
that.
think it's afternoon.
I think we need to wrap up
Yeah, we do.
the formal
Thank you
part.
so much.
But I'm here. If people want to stay and talk, we can certainly do that. But thank you all for
Oh,
coming.
it's a rich presentation. Thank you.